Hi viewers, I am Dr. Buvaneswari from GBF Fertility Center and Hospitals, and we also have another center in Dr. Ayla Institute and Medical Center in Crompet. So we are going to discuss today about IUI and their results, and before that we will take some questions. And first let us talk about COVID. As of now, COVID, we know worldwide almost 32 lakh people have got infected. In India, at least 25,000 have been reported. And Tamil Nadu, if you take 2,332 cases as of today, and out of 27 people have died. So it's really spreading fast. So we have to follow all the government guidelines depending on their state, and each one has different protocols and guidelines. So first and foremost thing is we have to maintain social distancing at least 3 feet away between each other, and hand washing. Hand washing is very important. Whatever we wear mask or do whatever it is, again if we touch somewhere, because it respiratory droplets will be there on every surface. When you touch that and bring the hand to the face, you are going to get infected. So always wash your hands before taking towards your face. And another thing is maintain all the respiratory hygiene whenever you go out as per Tamil Nadu government rule, and we have to wear mask. So that mask, again there are a lot of specifications are there. You don't need to worry about lot of things unless you are a healthcare worker or you are having any symptoms, or you are having a fever or something, you are going to see a doctor, then you have to really wear a proper mask. Or if you are going outside walking around, those situations you can just wear a cloth mask also. And again, whenever you have a symptoms like fever, headache, sore throat, sometimes you will have body pain, that is myalgia we call it as generalized body pain, dullness will have. Some people will have diarrhea, vomiting, nausea, some gastrointestinal symptoms you can have. Some people present just with conjunctivitis, eye infection. Some patients will present with just the tiredness and headaches. So we don't know, like they'll present with so many different symptoms as of now. And again, this is a new virus, a new kind of a disease. So we have to learn each day, and different types of presentations again getting published. Based on that only we can form a guidelines again. And again, we know that 80% of the people who have a COVID positive are asymptomatic. So we should be careful. We cannot take it lightly, thinking that the other person doesn't have fever or symptoms. You have to protect yourself and also protect others. So whenever you go to a hospital, please inform the hospital for landline, somebody whoever is approachable, or in the front office. If you have any symptoms of COVID, that is fever or body pain, cold, cough or sore throat, you just inform them so that they are well prepared to receive you. Again, when we are talking about infertility patients and pregnancy patients, always the first and foremost is you should make a telemedicine consultation first, unless it is emergency. In pregnancy, if there is any bleeding, any pain or any watery discharge, or you are near term and you are getting cramps, any symptoms when you are nearing your due date, you have to call up your doctor, and you can go to the hospital after informing them. But if you are not having any emergency situations, or fertility patients who are having embryos frozen or who are yet to start their treatment, they have to inform the hospital and get an online consultation. So in telemedicine we can do a lot more things, and you can avoid traveling. Second one is you can avoid infection to others, and also you will be also prevented from the infection. And most of the conditions like postponing the cycle or any menstrual irregularities or planning your cycle, some queries, anxiety, counseling, all those things can be done through online consultation. So in GBF Fertility Center and also Dr. Ayla Institute, we are doing and continuously available and online. So you can go to our website and see whether our slots are there. You can book an appointment and we definitely give you a solution. Even if there is any emergency, we can alert you, so we can give you a time which is comfortable, and in any emergency you will be asked to come for an emergency department and you will be properly screened and then taken up. So you now no need to panic, don't panic now. That's the only thing we can say. And for the fertility patients, again we assure you, don't worry. Once the lockdown period is over, we are going to start programming, and once we start programming, we are going to have certain protocols in place. Once those protocols, as per the guidelines, see there are worldwide so many guidelines are formed. Some guidelines are related to their kind of setup and government policies and patient's profile. So depending on our state's policy, and again many people are coming from all over the places. So again we have to think about their transport, and the infertility treatment is not one day affair. We all know that it requires a lot of multiple visits and injectables and procedures like that. So we'll be programming each and everyone individually. So if there is no kind of pooling all 10-15 patients together, we have to do individualized treatment and individualized protocol, and also few patients at a time we will be programming, so that you will be also safe and you will not get any chance to infection. So all these protocols will be informed to you through our website, WhatsApp and other mode of communications. So now we will take up some questions, and let us see that. And now they are saying that biconjugate uterus and IVF success rate. So it's biconjugate uterus is one of the interesting factor, because I have done multiple biconjugate uterus with septate. We have done biconjugate means it's nothing like during the development when you are inside your mother's womb, there are a lot of development happens. So in that one particular thing is after 5th month your reproductive system develops. When the uterus develops, it usually develops as a two organs and then get fused after that. So when there is some defect or some distance happens in that process, your uterus remain at least separated. There are 2-3 types. One, in some conditions the uterus completely separated and you will have two uterine cavities. Some uteruses partially fused and some uteruses completely fused, but only in the center it is divided. So that again division is called septate uterus. In this septate uterus, sometimes it will be only 1 centimeter or 3 centimeters. Sometimes septum can come up to the outlet. So that is a complete septum will be there. So depending on that we can reset. If you go to our videos, you can definitely see some videos we have posted, and a septal resection has been done patients, and people have conceived and delivered without any difficulty. So IVF again, whether if they have associated tubal problem or male problem, if they have an elderly age group or their ovarian reserve is less, moment we do all the IVF programming, we will be doing hysteroscopically septal resection, do an IVF and freeze the embryos. After freezing the embryos, we monitor your uterus, because after septal resection you need 6 to 8 weeks break. So we cannot transfer in the same cycle. So we will be transferring in the next month or 2 months later, depending on your uterine blood supply and endometrial thickness. So you don't need to worry about it. There are a lot of patients who are concerned. Even people thought of unexplained infertility will come when we do hysteroscopy. We are able to find most of the patients with polycystic ovarian disease and some genetic history. People have abnormalities in the uterus. Those are the patients will be able to operate and then okay. Next, a few questions. Okay. Urinary incontinence after delivery, what we have to do, ma'am? Okay. So, urinary incontinence during the delivery, definitely it is a significant history. So, if you are during the after delivery, because most of the time pregnancy, again there is a high pressure event. So, when the abdomen organs are increasing, your sphincter tone is not good, or because of some angulation in the bladder and the urethra, that get changes, or if it is over distended, or if you have a urinary infection you may have, or if you already had some urinary incontinence, so you may again develop after delivery also. If you have gone through a normal delivery or instrumental delivery, Then again we have to think of some local injury. You have to go and examine properly and get examined by the gynecologist who have done the delivery. They know that. So if they have done any instrumental or prolonged labor, again you will have an incontinence or urinary infection. So first thing is to rule out urinary infection, then you can go for it. So next one is Kadapa already come to your hospital. You will be telling next plan IVF, but Corona lockdown is now. Okay. So that's what I already explained in the beginning also. They are waiting for the IVF, and again you are in the different stage and different stage, but in that different state again the travel guidelines are totally changing every day, so we don't know whether when they are going to open up. See, locally there are some hotspots they are opening up, hotspots they are again not opening up the lockdown, but some places where there is no cases or no newly reported cases, they are going to open up. So we don't know about Kadapa and here how much is there and what area you are staying, and in that area what is the number of cases, what is the government rule, everything we have to assess. So at present I say that you have to wait for some more time and don't hurry up for this. Any pregnancy planning can be postponed. So infertility treatment again comes in under that. So as soon as we get this lockdown period was over and the infection rates are coming down, then you can safely travel, because again traveling increases and again stay outside. So we have to think about many things. So before planning an IVF, it has to be programmed well. So you don't need to waste your time, and also coming here and without completing the cycle, it is difficult. Even if you get any infection, so we'll be quarantining, we'll be cancelling the cycle. So we don't want all those complications during the IVF cycle. And there's another one, Saranya. Laparoscopic treatment is mandatory if IUI is failure for more than 3 times. Okay, it's a really good question. Today I wanted to discuss about IUI only. If you say that she has done 3 cycles of IUI, so definitely you need, if you have not done any of the tubal patency test or investigations, you can go for the laparoscopy. Why I am saying, if you are young, your husband's side is okay, mild or moderate sperm abnormalities, and you have gone for an IUI, and if it fails, we have to go inside and see tubal patency. Many times we have seen after many 6 or 10 IUI cycles, when they come and we do simple X-ray, we will be knowing that tubal block. So again some people straight away they go for laparoscopy in a peripheries where they won't have any idea of the tubes. So when they do a laparoscopy straight, so they are not prepared for hysteroscopy or cannulations. So if they find some tubal block, we are seeing them saying that it is a bilateral tubal block and sending for IVF. It's not like that. If you are already known in a fertility centers, you will be assessed properly. Even if you are not taken HSG, the center should have a laparoscopy facilities. Along with that, hysteroscopy has to be done, and if there is any problem encountered, immediately that problem should be rectified. So here we have a complete team of people, and we are well prepared for any complications during the laparoscopy. So even if you find some abnormal findings, because most of the time in laparoscopy, in infertility patients, outside nothing will be seen. Only when we go inside, we will be able to see lot of things which are undiagnosed before. Many times we have seen completely frozen pelvis, that is completely covered by all the intestines and bladder, and sometimes severe infection or endometriosis, which is even the grade 4 endometriosis, which is not diagnosed in ultrasound. So many situations we may face like that, but if we are prepared and we have every equipment, so when we do that, even if we find something like that, we will be able to tackle and complete the tubal cannulation. So in IUI cases, again as I said, IUI is a first simplest procedure in ART centers, but again IUI, you know that it is only 10 to 15% per cycle, that the success rate is only 10 to 15% worldwide. When you say 3 cycles combined, it's almost 21 to 22%. That is what we are thinking here. Again, IUI cycle depends on many factors. Your age, ovarian reserve, and your tubal patency. That is, your tube should be really, really healthy, and your husband's sperms not less than 5 million at least. When we take your semen analysis, your husband's semen analysis, at least 5 million total, at least motile sperms should be there, and we will be calculating a fraction, motile fraction, total motile fraction. That's what we usually calculate. It should be more than 1 million. Then only the IUI has the success of even that 20%. So we have to understand all these factors. If everything is properly stimulated, that again lot of studies papers, natural cycle IUI versus injection cycle IUI. That is, when we give induction and injections, you have a better success rate. Doubling of success rate is reported in every studies. That is why most of the patients, when they don't conceive naturally or with a simple IUIs, we can give ovarian stimulation and then do IUI. You will have a better chance. Again, as she said, like if 3 cycles have been done without any testing, tubal patency testing, you should go for the laparoscopy to get more idea. We have seen many things can be diagnosed in laparoscopy and we can correct it. After laparoscopy, even without IUI, many people have conceived. So, there is always a positive effect following laparoscopy. So, next thing is, do birth control pills help before eating and whether it is mandatory for all patients? And okay, so hyperthyroidism, there are few questions, I just read it and then we will answer for everything. Hyperthyroidism. For PCOS patients. Okay, so here we are 2-3 things I want to highlight here, and see, one is that hypothyroidism. Hypothyroidism, 2-3 people have asked, and hypothyroidism again, once your thyroid levels are checked, if the TSH, that is the main thing they will be checking, TSH is very high, then you are called hypothyroidism. So on the TSH again, along with that we have to do another T3, T4, there are another hormones we have to check, and based on that again it has to be tested fasting and early mornings. Once we get the proper reporting from the proper lab, you will be labeled as either hypothyroid or hyperthyroid depending on the TSH values and other parameters. So if you are hypothyroid, there are a lot of reasons are there. One is dietary deficiency or autoimmune or post surgery. So many issues are there. But when we talk about hypothyroidism, that is very commonly seen, and you will be obese, you will have symptoms, and fertility patients many times we have seen along with the PCOS, they have hypothyroidism and diabetes commonly presented. This is the complex diseases, metabolic disorders we see them. So in that hypothyroidism, again if you are taking medicines properly, if it is kept under control, that is TSH between 2 to 3, then you can plan your pregnancy, no problem. But you must take medicines at any point of the time. You should not leave. Even on the day of surgery, we ask you to take with sip of water. So it is that kind of importance should be given for the thyroid medicines. So hypothyroidism is correctable, and once under control, there is no difficulty in conceiving. Without correcting, if you conceive, then again miscarriage rates are there and preterm risk is there. Again in the child, there are a lot of developmental delays can happen if it is very high thyroid level and not treated. So that is why we will be checking every patient's thyroid level. Even if you check earlier, again after 6 months of warning, you can repeat it, so that these are all the complications we can avoid. And another question is about pills. Oral contraceptive pills, again oral contraceptive pills we generally give. It has a lot of benefits, at the same time very minimal risk of thromboembolic disorders. So during this period when you are not ambulatory and when you are not supervised, I would suggest not to take any of the hormonal pills unless we have seen you recently, and many patients we are seeing in between, and we are regularizing your cycle with the supervision 1 or 2 cycles. That is okay, because we are postponing ET embryo transfer. That's what they are trying to say. When we are postponing embryo transfer, if you want to get a regular cycles, and you will be advised to oral contraceptive pills. Again, you don't need to take many cycles. It's not a must for the embryo transfer. It is mainly to regularize your cycle and keep your bleeding under control. Many people will have irregular cycle and bleeding for a longer period of time. Then you will go for anemia. That is where we want to avoid all the complications. Or some people, usually they have a polycystic ovarian hormonal problem. In that again they will have a delayed cycles, and we cannot plan again when you are coming for an embryo transfer cycle. Your hormones will be again unbalanced, and so because of that some complication can happen. Again we have to check your hormones, and 1 more month we have to wait. That is the reason we generally put for the patients who have some problems or their hormonal, that is LH hormone is very high. We generally put oral contraceptive pill for a month or before doing the procedures. But during this period, I would suggest not to take for longer period of time. Only if I have done a teleconsultation and I have taken your history and properly I know your file, and if I have suggested, you can definitely take. Otherwise, for the elderly patients who are taking other medications, or if you are not ambulatory and if you have any other high risk, better not to take oral contraceptives as of now. And next thing is, okay, so after failed IVF cycle, how long does it take for a cycle to start? Okay, so generally for IVF cycle, if you are given medications, the moment you stop your medications, you will be getting, some people even before they start the medications, once the pregnancy is not there or the embryo is getting degenerated, and by the time your cycle 18th day, 20th day, you will be starting your periods. If you, some people are having high progesterone levels, then it may take some time. The moment you stop your medications, that is 5 to 7 days you can wait. Within that period, you will be getting your cycles. So if you are not getting even beyond that, if you have gone for a fresh IVF cycle, there may be some cystic lesions. You have to come for the hospital and have a scan. But again, I say that during this epidemic, you don't need to worry about that. It is nothing emergency. Unless you have a pain or any complications or heavy bleeding, you can come out to the hospital. Otherwise, you can definitely come for the online consultation. And next, IVF cycles again. Let me. So rubella test value is IgG 224. Okay. So here they have given me that test reports. That is generally we call it as TORCH, or sometimes separately only rubella infection or CME infection can be tested. If they have a previous abortion risk, if you have already 1 or 2 abortions and the doctor has suspected something related to viral infections, and then you will be asked to do these tests. But for infertility and sometimes failed implantation, failed recurrent pregnancy loss, you will be asked to do certain tests. There's not only this infection screening, and also sugars, karyotyping, some genetic evaluation is required. Again, when you say that these values IgG and IgM, so IgG is an antibody. During this COVID period, you also must be hearing lot of rapid testing. So IgG means is an antibody which will be giving you protection. So when you are getting infection, that is exposure to infection, your body produces antibodies to fight against it. So that usually when you get a contract infection now, after 6 months, you will be slowly getting antibodies against that infection. So no longer you will be prone to have that infection, you are protected. So that's what the test means. So here IgG positive means, many times I have seen patients coming, madam, IgG positive, I am worried about it, so they have been given vaccine. So without knowing the basics. So IgG is a chronic infection. IgM, there is another antibody which has to be tested. If that is positive, you are in danger. That time you should not plan any pregnancy. But if you are having a IgE positive, that your value says that you are really protected. So you are so that you are having a very less chance for the infection. That is what it means. So you don't need to worry about that. This antibody testing, always IgG should be positive, IgM should be negative, or both can be negative. So that again it's okay if the IgM and IgG are negative. Either you never got exposure, so you don't need to worry. But rubella and other things, if you are planning a pregnancy, we generally give if you are negative against this thing. If you are not having proper antibodies, then we may give you vaccine to induce antibody reaction, so that in future you will be protected. Otherwise, early miscarriages mainly because of rubella also is one of the reasons. That is why we try to avoidable reasons we can prevent. Maybe may not be 100% foolproof, but I think rubella has certain complications in early pregnancy. So we can, there's no harm in giving, because in childhood also we are getting, even adolescent girls around 13 to 14 years also rubella vaccines are given, or MMR vaccine. If you would have had, you would have known that even the government has that program, so you don't need to worry about that. So once you are having a IgG in a good value, you don't need to take any vaccines, you can plan for a pregnancy. And next one, there is my native block, both says block. Okay, recanalization. Okay, so in this she has asked, I don't know, Preeta, your age and your husband factor should be again analyzed, and your ovarian reserve we need before going for any treatment for tubal block. As I said many times, tubal block is not only the thing. Straight away for the tubal block, answer is IVF only. But when you are thinking about the natural conception, tubal surgery or tubal recanalization, when we are doing, it is not a recanalization, it is usually corneal cannulation. That is, hysteroscopically we will be doing surgeries to remove the blocks. So those are the procedures we will be doing. Those are the treatment, again depends on that. See, for example, say you are around 38 or 40, your ovarian reserve is very less. By AMH we can make it. So if the AMH also is very low, your ovarian reserve is low, or your husband factor is there. So in those situations, there is no point in doing a tubal surgery or putting you in the risk. Again, even if I remove the block, you are going to go for an IVF for some other reason. So we have to overall assess. That's why it's very important for you to go to the experienced fertility specialist, where they can treat you holistically, not just the patient. Okay, individually each and every symptom cannot be treated. So we have to make a diagnosis which will give you the high pregnancy rate. Here you want only the pregnancy rate, whether through natural IVF or IUI, but whichever you always want the treatment which will give you high success rate in a shorter time. That's what everyone wants it. So for that reason only I am talking here. So you have to know your age and your other complications and your ovarian reserve. Without all those things, if you have a ovarian reserve of 0.5 or 0.6, that is less than 1.1 is bad. So then if I do one tubal block removal, again I cannot say you will go for a natural conception. That is the reason. So if there is a mid-tubal block, again depending on the, because most of the time it is towards the uterus, corneal blocks are the infection reasons. Mid-tubal blocks, most of the time if there is any previous ectopic or previous any surgeries, any traumatization is there. So in those cases, mid-segmental, if it is a longer fibrosed, that is scarring of the tube is there, even if I do corneal tubal block removal, again natural conception is not possible. So that is why we will be usually assessing mainly laparoscopy only. So we can put a laparoscopy and go and assess the pelvis, that is your area around your uterus, tubes, ovaries. We will be assessing all that, and once everything is clean and there is no chances of infection, then we can definitely go and remove the tubal block. We have done many tubal block removal and people have conceived normally, not only first, not only one child and two children also they have subsequently. So that is where it is depending on the personal assessment of the individual patients. So again, TSH again 0.07, again thyroid only they were taken. So here they are talking about hyperthyroidism. So I already said about the thyroid. So we have to go through and listen. So there's another thing, HSG. We have test HSG. My FSH range is 17.99 and LH is 11.99. Okay, is this normal or any problem? Again, here we see patients having a normal HSG test. I don't know whether it is open or not, but I don't think it is significant here because HSG test hysterosalpingogram, that is an X-ray using a dye, is done in the radiology department to assess your tubal block. So whether you have a patent tube, that is open tubes or not, that's a test. So here again that tubal patency is very important when you are very young and trying for everything else is normal. We go and check the tubal patency. Here already hormones are very high. Again FSH, LH, these are the two hormones. Every time you will be noticing that in every center when you go for a treatment on second day you will be asked to do these tests. Again these tests are variable. Every cycle it will vary. So we need to keep on repeat it and before programming for any treatment cycle. And when we see that FSH more than 9 or 10, it is not a good sign. And here if you see both FSH, LH are high. LH again more than 6, take this cutoff, more than 6 again it is not good. But LH can be controlled because it will be high in PCOS only. You can do dieting, medications or some surgical treatment. You can bring down the LH level. But FSH indicates you are aging. That is ovarian aging or testicular aging. Both in men and women, FSH has a value. So if it crosses more than 9 or 10, definitely you have a problem. So that means your organs are going for a failure, either ovarian failure or testicular failure. So both the situations you need to hurry up your treatment. There is no point in testing the tubal patency and these other things, so that it will again delay your treatment and your options to have your own biological child. That is where very important. People take their own time when they know that their hormones are very bad. So by the time they reach out, there won't be any eggs left available for any treatment. So I will suggest if the FSH level is crossing 9 or 10 and your egg numbers, whenever they do scan they must be talking. So if the egg numbers are coming down at least 7, 8 like that, so you should hurry up your treatment. Either it can be IUI or IVF and you have to either store your eggs, at least store your eggs so that your future child you can have without any difficulty. So that is my sincere advice, because most of the time I am promoting this social freezing. If you are not interested in having IVF or you want to still have a natural pregnancy and normal, you can store your oocytes and then you can try for natural pregnancy. If doesn't happen, anyway you have something stored for you for future. So you have to take that this one seriously, and depending on your situation you can go for it. Next, even after taking 21 days hormone test periods, outcome pregnancy test is okay, negative. Okay. So this one again another question is iron deficiency and vitamin D deficiency cause miscarriages in first trimester. So these are some questions generally I see and then I'll tell you. And here they said that they are taking hormone levels, hormone tablets and pregnancy test. So if you are again the hormone tablets, if you are taking only progesterone as a support, you don't need to worry, because if you are having a pregnancy test negative, you don't need to worry. You can check your doctor. The time limit is being given properly, and then you can withdraw your tablet. You will have your cycles. So sometimes if you continue to take your medications, you may not get your periods. You must be thinking there is a pregnancy. Sometimes without pregnancy also, with hormonal support, the cycle can get delayed. So that is why we have to check if there is a pregnancy test is 100% surely negative, then you can withdraw your medicines. You will be having your cycle. Next one is again deficiency thing. In pregnancy, we have seen many times miscarriage rates are for so many other reasons, and early pregnancy alone is not a reason. Even iron deficiency anemia, that is if they are having a severe anemia, they can go for a low birth weight baby and preterm labors, and they can go for several infections. If you are having a very severe anemia, something called like some blood disorders, So again, in that case, you will be anemic. Those are the conditions. Again, your miscarriage rate can be there because of the genetic problems. So some people carry some like factor A, some factor deficiency can be there. So some anemias or sickle cell anemia, some genetic abnormal abnormalities are there. Those situations, your baby also can carry the disease or abnormality and go for a miscarriage. Only iron deficiency anemia per se will not cause miscarriage unless you are very severely anemic and in failure, where your oxygen level hypoxic, your lungs are not compensating hypoxic. In that situation, definitely baby also can get compromised with oxygen level and can go for miscarriage. Otherwise, there is not much cases reported straight away only for iron deficiency, which is easily curable, and you can get an investigation, hemoglobin checked and peripheral smear what type of anemia, and you can get supplements easily. You can have a supplements. Only thing is, in the first trimester, if you take iron tablets or injectables are not advised, and you will have a severe gastritis, and some people have severe hyperemesis where we cannot treat with a high dose of tablets. And another thing is vitamin D3, definitely it is a must nowadays for everyone. People who are coming for treatment, we will be usually giving that, because they are not getting exposed to the sunlight at all nowadays, and there is always high vitamin D deficiency we have seen. Whenever we are doing, like initially we were doing testing for all the people initially, but we have found most of them are having a less level vitamin D3 level. So generally now we started giving them empirically without even testing. You can take at least 2000 IU per day or 60,000 IU, that is international units per week. You can take like that. So you can take, and if it is there, sometimes even the polycystic ovary hormonal imbalances, people have benefit out of it. There is a role of multivitamins like vitamin C, E and D3 has a role in polycystic ovarian disease also. So you can definitely take. Not only for that, if you get pregnant, again for you to compensate your bone loss and other postnatal problems, you can continue to take vitamin D3 and calcium. And again, generally also when you are aging, again you need a vitamin D3 support for the bone strength. So next few cases, they have a severe pain during periods, married for 3 years and not conceived. Okay, it's endometriosis. What shall we do further to become pregnant? And there is another question. Second baby try pandu past 2 years. Okay, 2 times abortions. Any suggestions? Okay, so I am very depressed and 30 years. Two different conditions. One is that abortions, as I said, she had 2 abortions, and she is 30 years only. Definitely she has to get evaluated. See, we can't wait like olden days where we have 4-5 abortions, then we start doing it. Now even every patient, every pregnancy is important. So when you have a first the abortion, just some basic investigations can be done. But if you have 2 abortions in early pregnancy, definitely you need to go for a proper evaluation. We have a proper genetist and genetic counseling. We have a proper screening clinic. So you please have all the reports, and then depending on that, both husband and wife will be evaluated, and then you will be given a proper advice. You don't need to worry, because you will be going into depression. Don't worry about that. First you get the confidence. When you properly have a proper diagnosis, then you will be at least having a clarity in what direction we are working on it. So definitely you have to take folic acid, and before consulting or doing genetic counseling, please don't plan your pregnancy. And that too, during this period, you need to have a proper counseling, prenatal counseling, then only you have to plan for pregnancy. Next one is that for the endometriosis, she has a severe pain. Definitely younger patients with a severe pain and infertility for 3 years, it is a mode of diagnosis. The more history itself tells that they have a endometriosis. That's nowadays commonly we are seeing because of the lifestyles and diet patterns, and our high estrogen levels causes this endometriosis. So for endometriosis, you need a definitive treatment. So it is nothing like permanent treatment, because it's an ongoing process. Every month you bleed, that endometriosis is going to grow. So that's how it is. So the moment you stop your periods, it is going to reduce, and then that is not possible now. So during the period of trying for pregnancy, you need to get the disease under control. For that, One is that medical management, we can get a lot of newer drugs which are really helping to relieve the pain. So you don't need to go for any, previously we were giving injections and hormonal preparation which are very, very complicated and people were not tolerating. But in our newer drugs definitely will help them getting reduced your pain. Second one is your scan is very important, whether you have a chocolate cyst or not. If you have a chocolate cyst, we can go for a laparoscopy, and that laparoscopy should be properly done, because the first surgery should be the best surgery to avoid any further later complications. Otherwise, the disease is going to recur within 3 months or 6 months if you are not getting it done properly. So that is very important. Once you get a clearance done, and depending on the stage of the disease, either you can go for IUI or natural, and it all depends on the ultrasound finding and your severity. And I would suggest 3 years with all the symptoms, we have to go for a laparoscopy and do it properly, assessment, and if there is any problem, you can clear. Later on, definitely you can go for natural pregnancy. Only if you are aged and if you are severely like stage 4 or anything, then I would suggest not to wait more, because the more and more recurrences you will lose your ovarian reserve, and so it is difficult to have your own biological child. Next, there is another question. No gestation sac after IVF, what causes? Okay, most of the things, as I said, a lot of things related to miscarriages, and during this period we don't know what really happens, but generally whatever it is, there are some 20-30% of the time sporadic abortions are there. There are some people who are already elderly, even IVF you can go for miscarriage, because if you are around 37-38 years, or if you have a severe male factor, they can carry the abnormal genetics, so that can transmit, and embryo can be abnormal. See, when we are saying embryos abnormal, it's not what we see morphologically. What we see is the embryo normal or abnormal. If they are good looking embryos also can have a genetic abnormality. So that is euploid, aneuploid, we call that like that. So if there is a properly screened, genetically screened embryos, healthy embryos are called euploid embryos. So only when we keep those kind of embryos, we are sure that embryo is healthy. Otherwise, embryo morphologically looks great, but genetically we cannot say that. So genetically we have to screen, means we have to go for PGS or PGD. If you are elderly person or previous failures, either egg quality or sperm quality is very bad, or sperms any azoospermium, that is you didn't have a proper ejaculated sperm, we have to do a biopsy and take the sample, means more chances to have a genetic abnormality. So we have to, those situations we have to do a PGS. If we do PGS, definitely we can avoid miscarriage rate, at least to a certain extent. Next one is pelvic infection, because okay. So no gestation said, that's what I already said. And so again, PCOS, they have said PCOS patients. PCOS again, many times it because of the hormonal imbalance and weight only. So two types of PCOS, one is obese, another one is thin PCOS. Obese PCOS, at least they should reduce 10 to 15% of their weight. They need to know their target weight and try to get into that weight. Second one is your diet and lifestyle modification is very, very important. Apart from that, ovulation induction, because if you are very young, you can still give some time, at least 6 months to 1 year, to go for weight reduction, change of this. Obviously, you will have a pregnancy positive during that time itself. And if you are very elderly and PCOS is there for a longer time, nothing to worry about that. Just keep your hormones alone under control. Go for the treatment, you will definitely have a pregnancy positive. PCOS are the easiest one, they will have more good ovarian reserve. The same time, even if they become aged, they have some number of oocytes where we can select and do IVF. So IVF also will have more the eggs, we will get a higher chances of pregnancy. So in those patients we can have only certain patients like thin PCOS or resistant PCOS, or they have more male hormones dominant, when they have a high level of hair growth, acne, with the hormones like testosterone and all very high, those kind of patients again egg qualities will be very poor. So only those situations we have to select a number of eggs. Even if we get 20 eggs, sometimes we will only have 2 or 3 good quality eggs. So for those reasons only, sometimes PCOS also have a poor quality numbers on the embryos. But nothing to worry, they have high chances of pregnancy. Next one is, okay. So I'm not sure what they have written, but again rubella they have written, and hormone levels LH and FSH hormones are too low. One patient has written that hormones levels. Hormone level FSH LH, one condition I have said that high level. When there is high FSH LH high level, it indicates ovarian failure or testicular failure, or can be abnormal testing in the lab itself. So they have to redo that and make sure that everything is correlating clinically also. That is a different aspect. In another aspect is when both the hormones are very low, again it is serious issue where your higher level, even from the pituitary, that is in the head to uterus, there is a connection through the hormonal cycles. If that hormones itself are very low from your secretion from the head, again you are not going to have your periods, and it is again is sometimes it has some tumor in the pituitary, or some syndromes. So you have both FSH LH very low, but you don't need to worry, you can go and have injections replacement. So get evaluated properly, proper diagnosis should be there. Once if it is hypothalamic amenorrhea, then we have to treat you with hormones, both FSH LH hormones replacement can be done. You will have your cycle, and many times pregnancy is positive. And second one is IUI related, IUI one IUI and one IC are successful and got miscarriage in early weeks. Okay, so so many questions related to IVF and IUI, and IUI I will tell you that as I said that IUI has some indications, and again same times contraindications where we should not go for IUI. Everyone should know. See, IUI can be done for anyone by anyone. How many number of cycles we don't know, but there is a guideline. There is always we have to look at scientifically, see that whether somebody is having this many number of cycles, what is the success rate, and if they have at least this many number of cycles, what is the success rate. So far worldwide we know that not more than 6 cycles are advised. So people keep on changing the doctor and doing so many cycles doesn't help unless they have not done properly in the earlier cycles, or they have done just without any preparation they have done, then they need to go for a proper IUI cycles. Here again IUI contraindication if the tube has any infection or tuberculosis history, or any abdominal pain or anything, pelvic infections, they should not go for a IUI. Again, if they have poor ovarian reserve or elderly patient, they should not go for it. If they have a severe male factor, if they have some rare 1 or 2 motile sperms, people will be doing IUI. We definitely know that even if it is 5 million, only 10%, 20%. So think about it. So don't keep on go for IUI and get infected. And again certain conditions like when you have a multiple recurrences and surgeries, so don't waste your time, because the more and more you take hormone medications and injections, your uterus is going to get spoiled and infection rates are high, though it is very less reported nowadays. If it is properly done centers, 0.02 that much only the chances are there for infection, but still we are seeing people doing without washing preparation outside, they just take the semen and inject inside, even many educated I have seen. But what will happen, what is the method? IUI, why are we doing? IUI is mainly washing of your husband's sperm. So husband's semen is containing of lot of things. It's not only sperms. Along with it, they have a prostaglandins, they have a WBCs, they have a dead sperms. They have multiple things along with the seminal fluid contains lot of factors. So when we wash it, we usually wash all those things. What we say is prostaglandins, usually it will go and induce the contraction. So when it is contracting, again if your natural conception, that's a different technique, that is why it is produced there. But in an IUI, when you put it that, it will induce the uterine contraction, your sperms will be ejaculated outside, that is expressed outside. So that is why we are washing out, infections will be washed out, and then your WBC count, everything will be washed, and only the motile sperms, even the dead sperms, most of the time dead sperms will be there. In the dead sperms, again they release reactive, that is ROS. So we have to wash out all those things. and take the sperm properly, and we keep the sperm closer to the tubal opening so that the sperm can easily swim to the egg and then get fertilized. So that is the concept of IUI. Again, we are bypassing the cervix, that is uterine mouth has lot of antibodies. Some people they have an infection, some people there is a difficulty in entry of the sperm into the uterus. These situations again, when we do IUI we can bypass this, and many times we do under ultrasound guidance so that we are very sure that we have crossed that area of abnormality, and then we place the sperms, and that gives more success because we are very sure that the sperms have gone to the correct place. So that is where it is very important. Sometimes if there is any difficulty, it is better always do under ultrasound. So it should be within that room so that you can have a ultrasound guided IUI. Another thing is miscarriage. Again, in IUI, you need a support. When you have taken injections, you need a progesterone deficiency will be there. And later, after the ovulation, most of the people need a progesterone. Nowadays, we see that most of them are having a progesterone deficiency. So, mainly for polycystic ovarian disease patients, they will have luteal phase defect. So, for that, they need to take a hormone supplement. When they take this hormone supplement, it will at least give the pregnancy support to an extent where the pregnancy itself takes over. After that, some placenta, everything starts forming. No? So they start taking over, they produce their own hormones, and that will give a pregnancy support. So till then we need to give. Or some people, when we are doing a frozen cycle, where your body, like your inner body's hormones are all controlled or cut off, there is no internal hormones. So we are giving externally all the hormones. So when we are giving that hormones, it needs to support the pregnancy at least till 12 weeks, till the placenta is formed. Once that placenta is formed, then the placenta secretes all the hormones that will give enough support for the pregnancy. Even then, some patients need continuous support. So then you can avoid lot of pregnancy complications, and early pregnancy bleeding is one of the main reason when they have a less progesterone values. And again, the rubella cases they have written, and I exceed successful, and FSH hormone, but ovaries are hyperstimulated. I did not get good eggs. I have low LH FSH hormone. Please suggest me what to do, how to get pregnant. Okay, so here two controversial thing is there, and I am not very sure about it because you have a polycystic ovarian disease where you get hyperstimulated. So when we are giving injections like how we are giving to other patients, if you are giving it to do the same high dose, again you have a high risk for hyperstimulation, that is forming multiple oocytes, collecting fluid and everything. Some polycystic ovarian patient we would have told you are going to get hyperstimulated, there is high chance for ovarian stimulation because we need to stimulate them to get more eggs. So to taking that risk, but we will be warning and taking care of that. If they develop early symptoms, and then we start giving them some prophylactic medications, and if it is severe we can definitely manage, but nowadays it's not required with all the protocols and things. Only very rarely we get the IVF hyperstimulation nowadays. So even if you get hyperstimulation, your egg qualities will be very poor. Many times your egg quality will be very poor in hyperstimulated ovaries. Only here when you are talking about a low LH and FSH, it is very unusual unless you are taken contraceptive pills or some long injections. Injections are given to suppress your cycle, then your hormone level will be less, or only when we stimulate your hyperstimulation risk is coming up. So you have to check that previously what medications you are on, and then depending on that we can decide. But once ICSI failure, no need to worry, you definitely have another try, and this time proper stimulation protocol can be changed, and good quality embryo should be given so that you will have higher pregnancy rate. And I have irregular periods past 2 months. Okay. Descom tablets. So all this again, as I said, this period many of the people when they have irregular cycles, you don't need to worry. See, unless you have a polycystic ovary, every 2 months or 3 months you have to take progesterone to avoid complications of your hormones. That is, in polycystic you have a high estrogen level. If you are not taking progesterone, that is another hormone which will neutralize the side effect of this estrogen hormone. If you don't take it, you will have irregular bleeding or your uterus wall will be thickened. You will have a chance, very rare chance for cancer in a long term. So that is why we say that once in 2 months or 3 months you can go for a progesterone therapy. But some patients that tablet is only oral contraceptive tablet. You don't need to worry. You can definitely take. Your doctor has advised. That means she knows your age, risk, and associated complications. And if they are given, definitely oral contraceptive is the only pill which is consumed all over the world. And only we are saying here is during this period, if they have high risk, if they are not ambulatory, if they are taking other medications, definitely it has to be consulted through telemedicines and explain your history, drug intake, and then if they say okay, you can definitely consume, and otherwise no problem. Most of our patients also we put a tablets, contraception tablets. Next, before laparoscopic procedure, endometrium lining was 11, but later it is not going above 5, even after PRP, HRT cycles. So another thing is clomiphene, lot of medications you asked. Okay, in the laparoscopy again she said something like that. Previously laparoscopy, before laparoscopy, if they have a polycystic or high hormone levels, that endometrium would have been very thick. So when it is thick and when they are doing laparoscopy, hysteroscopy, generally they take biopsy, or because it was maybe it was thick and endometrium or any polyp was there, they would have curettage will be done, DNC would have been done. So in those situations, you may take some time to grow your endometrium. Or if you are not growing, then again we have to give you some hormonal pills. If you are continuously taking your regularizing pill, again your endometrium is not going to grow. So you need to give a break for all the medications, and after 3 months or 4 months you can go back. Your endometrium will regrow. Unless there is a endometrial pathology or sometimes some infection, or sometimes your endometrium is refractory. Previous assessment we have to really see whether it was a proper endometrium or it was only a polyp, it was looking thick or anything. So with a proper history we can definitely have, and most of the time endometrium will grow unless there is a tuberculosis, undiagnosed tuberculosis or Asherman's. Your endometrium will not grow even after PRP. Very rarely we get all those things. In those conditions, we only try, because we cannot say that, but whatever possible we have to try. We have to give a PRP, stem cells, and all the scratch and so many things they would have tried. Even the copper can be placed. Even in spite of that, if it is not growing, better to leave it for some time, not to traumatize so much to the endometrium. You give some time. If there is no infection, it will grow after some time. Otherwise, permanently, if it is looking like that, a better option is uterine transplant. Generally, we do it for Asherman syndrome, that is patients who are affected with tuberculosis or completely uterus endometrium is not seen, and some anomalies in the uterus, people who are born without a uterus, people who had a hysterectomy done for some various reasons before having a pregnancy. Those situations we still advise uterine transplant if they want to go through a pregnancy. Always adoption and surrogacy options are given and counseled, but if they really want to have by themselves, they want to experience the pregnancy, then uterine transplant program is available. If you want to know about it, definitely you can write to us or you can come to online consultation. Next one is pregnancy patients, beta HCG level is below 2. Okay. So pregnancy, again beta HCG level, one thing we have to understand, depending on the days you are taking your beta HCG level, it can be in lags, it can be in the middle, or it can be very low. If it is less than 50 or 100, we have to very cautiously deal with that. And because if you are done after 16 days or 18 days or 20 days, we have to know, depending on the again number of days ovulation time, we have to understand. And if it is IVF, we know if exactly 16th day or 18th day we will get the pregnancy test done. So on those days at least it should be above 50 or 100. And if it is less than that, we will be repeating after 48 hours and see. If it is 200, it is definitely negative only, and you have to go for another cycle. And next one is PCOS. Why do I get symptoms? PCOS. Okay. So more and more PCOS patients we are seeing. We generally said that in infertility it is only at 10%. But when we see that multiple patients in a OPD, almost 40 to 50% of the patients are having a PCOS problem. That is mainly because of the lifestyle problems. Why it is increasing so much nowadays? So again and again I insist that you should, this is the time you take off now, you are all at home and you have more time to concentrate, and please do dieting. Dieting in the sense you can follow any number of diets. See, I cannot say go for keto, paleo or this or that, because each one has their own style of thing. So you have to assess what is your weight and how much is your this one weight loss required, and target weight. You have to fix something, and for that you have to calculate the calories you are taking it. So depending on that you have to proper diet. Definitely carbohydrates should be reduced. Take a brown rice instead of white rice, and no sugars or sweets, 100% nothing. And then take more salads and vegetables, not to eat after 6 or 7 o'clock. So that's a basic mantra you can follow. And exercise, definitely you cannot go to the gym, you can do something at home. And soon we are going to release some videos on yoga and fertility, so you can wait and watch all those things step by step. It will take some time, but we are going to do it. So you can follow all those things. Even proper yoga will reduce your stress, depression, and you will be you will not be snacking so much, because people more of time they will be depressed and stressed and they will start eating everything available. So you stop doing all those things, and take a proper rest. And I think that's actually now there is no excuse for the rest now, and you have enough rest. So you follow all those things, and then your PCOS get control. I am hearing more and more people calling up saying that they are getting pregnancy test positive. So I suppose this period, and it will help them to reduce their anxiety and stress, and hormones can be balanced. And then if you follow the proper lifestyle, definitely you have a more chance of pregnancy. So with that I would like to conclude saying that during this corona period, and you stay safe, maintain social distance, and maintain again respiratory hygiene and hand washing, and properly for the fertility patients, you reduce their anxiety and stress, be relaxed, take this opportunity to have a normal conception. If you are not there, we are anyway there after some time. It is first and foremost is your safety, then only pregnancy. Again, early pregnancy, we don't want to go through any risk or complications. In case if you have already conceived, you are pregnant, again don't panic. We are there, we are available all the time. And if you have any queries, you can call us, and then we will rectify. Take proper medications and proper diet. Stay safe. Thank you. And if you have any queries, comment, you can write in your comment box. Again, last time we had a lot of questions that we have answered, and this time also I was seeing more and more questions. So we are going to combine all those things and answer in the next YouTube video. And you always subscribe for our YouTube channel, so that you will have a continuous videos, and get awareness regarding the IVF thing. And live YouTube channels also will be doing in multiple languages, and whichever language most see, I can talk only few languages which I can talk, will be doing it. And you can just follow us in our YouTube channel. And if you want to have any online consultation either in Mogapay or Dr. Ayla Institute and Medical Center, you can go to the concerned website and you can fix up an appointment, and we will be able to talk one to one and give a personalized protocol and advice. Thank you.